You wouldn't buy a car without a seatbelt, a laptop without Wi-Fi, or go a day without your cell phone. Could a business survive without the internet? Then why are many healthcare providers and provider organizations still not connected and enabled to share critical clinical information digitally in the care of your friends and family? Welcome to Kno2fy, a podcast from Kno2. Join host Dr. Peter Schoch, Chief Health Officer, and Therasa Bell, Founder, President, and CTO, as they bring the profound impact of healthcare communication to life through frank conversation in understandable language and through real-world context. They'll demystify interoperability, helping you unlock the potential of healthcare communication at scale. You'll also learn the transformative impact of being Kno2 connected. Connect, listen, transform.
Welcome back, everybody, to another episode of Kno2fy. Dr. Peter Schoch, along with Therasa Bell. Happy to have you with us today. Therasa, I'm excited about our topic today and our guest today.
I agree. This has been one that I've been super passionate about. I had the opportunity to meet this group, and we're joined by the CEO, Travis Rush here. But had an opportunity to fly to Portland, and they had a launch event, and it was amazing. I'll just say that. And watching what the technology does, that Reperio is the name of the company. Travis Rush is their CEO, and I'll introduce him here quickly. But watching it in Portland and then all the participation, it was just a fantastic event. And I'm excited for our broader Kno2 connected community and those that listen to this podcast to understand more about what Reperio does and of course, how Kno2 is playing into that, what it means to be Kno2 connected. We know we use that a lot. In this case, it's really special to me, and I think it has a lot of opportunity. So excited for that. With that said, Travis, I'll hand this to you. Travis Rush, their CEO with Reperio. You could just tell us a little bit about yourself and the company. That would be great.
Sure. Thanks, Therasa. Hello, everybody. Hello, Dr. Schoch. I have been in the healthcare space my whole life. My father's an eye doctor, and so is my sister. So I grew up in that part of healthcare. So I know the problems that existed in that space very intimately. And, you know, the eye care space is smaller, but still has the same problems, just at a different scale. And I'm excited to be, trying to help solve some of the bigger problems in the larger healthcare systems and working with Kno2 to do that.
That's fantastic. Travis, you say you've always been in healthcare, but I did a quick Google search on you, and you also have a hobby. Is that right? Can I bring that up? Is that fair game?
Sure. If it's on the internet, I guess it's fair game these days. Yes, I have a history in the music world, country music specifically. And kind of a funny side story. I spent a bunch of time in Nashville recording. I have a couple of albums out there, and went to Nashville a lot to do recording. Wasn't going there for healthcare. And when I started getting deeper into the healthcare industry and went out to Nashville, I learned that Nashville is actually the healthcare capital of the country, which I didn't know, which seemed totally strange to me because they call themselves Music City. Come to find out, just a sexier name. Healthcare City is not as cool. So it all makes sense. But that was my introduction to the fact that healthcare is the focus of Nashville, not music, even though that's how I got started in Nashville. But now I'm out in Portland. I've lived here for 30 years. And yes, so there is a history that is not tied to healthcare at all.
And I didn't mean to put you on the spot. You're a great sport, Travis. I figured we've met a couple of times, so I figured you'd be sporty enough to let me ask that question. Well, great. I can't wait to get into the conversation really around who Reperio is, what they're doing, how they're serving patients and providers in healthcare, and then the impact of being connected, because I think you guys are doing some unique things. So let's take a quick break. We'll come right back and we'll get right into the discussion. I can't wait for the audience to take part.
Only 1/3 of employees use preventative health benefits. Annual screenings can catch conditions like high blood pressure or diabetes early, saving on healthcare costs. Reperio Health offers at-home biometric screening kits, FDA cleared and completed in under 30 minutes. The Reperio app guides users to instant results for glucose, cholesterol, BMI, and blood pressure. Anytime, anywhere. Visit reperiohealth.com for better health.
Connect, listen, transform. This is Kno2fy with your hosts, Dr. Peter Schoch and Therasa Bell.
Well, welcome back, everybody. And I have to be honest, Therasa, during the break, felt like a long break to me because I wanted to get back to this conversation. First and foremost, let's just start by setting the baseline for everybody's understanding for the conversation today. And Travis, can you tell us about Reperio, its history, its mission, what you guys are doing, where you are now? I think that'll set the backdrop then for a rich conversation around virtual care, the challenges, the relevance, all those kinds of things that we want to talk about.
Sure. Reperio started out, our primary focus, well, I'll even back up a little bit just to kind of explain why. Telehealth has been at the forefront of things throughout COVID, and it became more relevant than it ever had been because it had to be, right? We had no way of getting to anyone to get the care, so telehealth rose to the surface to help solve that problem. The problem with the way that it rose to the surface is it only solved one problem. And that problem was in the middle of a doctor visit, which is the conversation. And that's great. You can have a conversation with the doctor, but first you need data. Without data, that conversation becomes just that, a conversation with no data to support any decisions that happen on the back end. So what we really tried to focus on initially is that data part. So we started out as our kind of three-phased approach to our business is number one, building a biometric screening kit that could be delivered directly to people's homes quickly. So we have partnered with Uber to be able to do that so that a kit can be dropped off within an hour of you requesting one. And then being able to do not only biometrics as, traditionally with blood pressure cuff and BMI and all that, but also a blood panel. That gathers all of your cholesterol readings, your total cholesterol, LDL, HDL, triglycerides, as well as glucose. Now, when you take that data and have that in your hands, and now connect with a doctor over a telehealth or virtual visit, as we're calling it these days, now you've got something to talk about and something to act on. And so that's how we started our business strategy. Now we're moving on to the virtual visit piece.
Yeah, I love that. And there's so much I want to unpack there. I want to start by also just adding emphasis to the fact that virtual care has always been something that's been talked about as the next greatest thing in healthcare. Yet it never had the adoption at the point of care in mainstream healthcare prior to COVID for a number of different reasons. And some of those reasons went away with the emergency declaration that was COVID, when compliance related to what type of device could be used. The HIPAA privacy laws were relaxed to allow certain technologies to be used that weren't able to be used before. So docs could then FaceTime for a period of time to do virtual visits. The reimbursement models had changed so that payers were now recognizing that was the only way to deliver care. And so they were going to pay for it at the same rate that they paid for an in-person visit. And then there were other compliance and regulatory things around providers licensed to be able to provide those services across state lines and those kinds of things that were relaxed during that period of time. And you saw virtual care go up to, in the health system I was in, we went up from anemic single-digit percentages to 60 or 70% at the peak.
Right.
And then it's dropped down. It's not going back down to single digits, but it hasn't maintained that high level of adoption. Partly for the reasons that you're talking about, I think, which are really important.
Yeah, I mean, and actually this can kind of accentuate that issue. What's happening with the payers at this point is they're realizing that in the COVID version of telehealth, they're paying now post-COVID for 2 visits, right? You're having a telehealth call with a conversation, and then you have to go get tests done somewhere and then have another call. So the payer's having to pay 2 times for this visit because they can't get it all done in a single. What we're doing to change that is our kit produces all those results instantly. So now that data happens in the first visit. So now it's a one-time virtual care visit that has to happen with one billing to the payer.
Well, and I'll be honest with you, Travis, that's even better than, so when I was in practice, we always had the dilemma. Did I get a patient go get their labs done prior to coming to see me, which meant that they had to go twice? Or did I, and had to go before I saw them, so I would have the results? Or did they wait for me to see them, order the results, and then they had to go after I saw them? And in either case, I then had to call them back. They could get them drawn that day at the office and sent off to the lab, but I'd have to call them back asynchronously to evaluate those labs. So even outside of the COVID situation, virtual care, you're solving for something that's a convenience factor that hasn't existed very well in clinical care in the past.
Right. And it's not a cohesive visit in many cases, because the person, when they try to re-engage after they get the results back, they end up re-engaging with someone else.
Yeah.
That's not the person they talked to the first time, which creates a very disconnected experience for the person.
Trace, it sounded like you were going to say something there.
Yeah, from a technology perspective, one of the things, technology and what I thought was interesting, in addition to what Travis is saying, is the resource utilization. So as we face into significant healthcare challenges, including provider shortages, the ability to utilize our resources differently, our providers differently, and the way that Travis's, and I don't mean to speak for you here, Travis, but the way I understand Travis's platform to work is it becomes something that a nurse practitioner, for instance, can do to optimize their time. So as they may be sitting in a clinic or they maybe have some downtime, he's utilized that to offset some resource. And as we look to get care coverage everywhere, including rural areas, everything, it is a very interesting twist that says these are the way that new care models will come forward. Because we have to address these shortages, and virtual care is literally the only way to do that. So Travis, if you don't mind providing a little bit of light on that one, I think it's really important.
Yeah, and there are already all kinds of stats out there reinforcing that fact. People want this. They want this virtual care component. It's the healthcare system that seems to be the one fighting it. A survey was just done literally in the last week here by the National Consumer Healthcare Survey. They found that 40% of respondents would prefer a virtual routine appointment over in person. 40% already. That's what people are asking for. And then on top of that, from that same survey, 48% of the patients say that they missed or avoided their healthcare visit last year for top three reasons were high costs, which we know that problem has been existing and growing for a while. But I think the second two reasons are really the ones that we can solve for more immediately, which is the availability of appointments at a convenient time. People have lives, they have kids, they have pets, they have work. There's all kinds of things going on that they're trying to manage while also trying to go to some brick and mortar building to do an in-person routine doctor visit. It's not convenient, and therefore they procrastinate. Life is always way more fun than going to the doctor. So even if they do get an appointment, weeks down the road, life is going to happen and they're going to decide which thing is going to go, and guess what's going to get postponed. So, but beyond that is they can't even get an appointment half the time. I mean, I've talked to so many people that 6-8 weeks out to get an appointment, which, for a routine annual wellness visit, that's fine. But when you don't feel good, that's unacceptable. I mean, and then you hear the healthcare industry fighting that you're engaging, people are doing virtual care. It's not the same. It's not as good. And it's, you can read comment after comment online of people saying, well, what did you want me to do? You didn't leave me with another option but to do virtual visits and have virtual access to healthcare because I needed help. So I think the healthcare company needs to stop complaining about how it's being done and help support what the people are asking for. If you go back in history, and yet Blockbusters didn't listen, BlackBerry didn't listen, Sears didn't listen, Kodak didn't listen. The list goes on, and the healthcare industry is not paying attention right now. There is a paradigm shift that's happening that the people are demanding, and they are fighting it, and they're only going to hurt themselves because they're going to get pushed out.
Yeah, it's interesting. There's a number of points you made that I want to emphasize. Number one, the convenience factor is incredibly important. Nobody in their right mind wants to call and ask permission from somebody in my front office to come see me at a time that's convenient for me, right? And the time that's convenient for me is usually a very limited window. Nobody wants to do that. We don't live our lives that way, right? And even if you have to wait for a routine visit, it's still unacceptable to me. And the reason is because I live my life, I think, like most Americans do. If my registration for my car is due or my inspection for my automobile is due where I used to live in Missouri, I was not proactive about that, right? And meaning I didn't sign up 3 months in advance with an appointment with my mechanic in order to get that work done. What I did was drive around probably 15 days after it expired, waiting, trying to, not be detected, and look for a place that could get me in that moment when I had time to do it and when I was thinking about it, right? Like somebody going to urgent care or going to a virtual visit, because I didn't want to ask permission. I just needed to get it done, and I needed to get it done when I needed to get it done. It was convenient for me. So the convenience piece is a huge, huge piece. The other thing that I think the other thing, Travis, I think that you mentioned, and I don't want us to gloss over it, and Therasa mentioned it as well. You guys are changing the value of a virtual care visit by providing additional data. So I can tell you that 85% of what I need to know to make an accurate differential diagnosis as a primary care physician is a conversation, but it's a conversation that gets specific data from a history of the present illness, a thorough review of systems, past medical, social, psychological history, et cetera, surgical history, et cetera. The other 15% that has never been present in virtual visits is the data of a pointed physical exam or laboratory data, and you guys are providing that. So now all of a sudden it is a full visit. It's not a part of the visit conversation like you were saying, which has value, but can't go the nth degree and doesn't span a number of use cases that we need to span. So anyway, a couple points that you made that I think I just wanted to emphasize from the provider side of things.
Yeah, I totally agree. And the appointment thing that you're talking about, just to hammer on what we want, what the reality of what is actually happening is, I think most people know that 100 million people in this country, over 30%, don't have a primary care doctor for that specific reason. It's too hard, and they can't. I've talked to people that have even had a primary care doctor, but every time they talk to somebody, they get a different primary care doctor. So they have like 5 primary care doctors because they can never get in to see the same one twice. So, we can go on and on about all the reasons why this all needs to change, but I think we're making progress. And I think what you guys are doing at Kno2fy is that next piece that we need to really emphasize what you were just saying about a comprehensive discussion with a patient. Our data is great. That in the moment data that is from, an hour ago, that's obviously super helpful, but then you also need that history, right? And without the history, you don't know what has been done before, what issues have existed for a long period of time, what's brand new. You need some context around that conversation, and relying on the patient to inform you of everything that should matter. They don't know what matters, and that's not an insult to people. We're not the doctor. We don't understand when you're asking a question that this thing that happened 2 years ago is actually relevant, even though maybe in our head, we're like, oh, that doesn't matter. I'm not going to bring that up. When we, you, the doctor, can get access to the historical data and having the moment data, like you said, now you're able to have an actual visit that is comprehensive.
Yeah, I love that. And Therasa, I always do this to her, Travis. I always chime in, and I never give her a chance to speak. So Therasa, please just chime in. But I think the other point I would emphasize about that I do want Therasa to weigh in on is that is one of the other key things that is differentiating virtual care now, as you guys are providing it, than virtual care in the past. And that is, you guys are seeing the value of actually being bidirectionally connected to the entire healthcare ecosystem. And I hate to use this word, but I can't think of a better one right now. There is a better one, I'm sure, but it legitimizes and solidifies the importance of that virtual care visit as a healthcare visit. It's significant in that patient's journey, because now you can get information from the healthcare ecosystem and you can share information back. That's incredibly important, and I think something that is setting a new model for virtual care that wasn't present a year ago, 2 years ago in the COVID timeframe. And I think really important to moving virtual care forward.
I would agree with that. I would actually expand it from virtual care. The ability to get information is something that all care whether it's virtual or in person. And I can relate it to a personal experience, and Dr. Schoch knows this too well. We did three podcasts on it with my dad. The ability to create, not only to inform the provider, but to create that warm patient experience when I don't know you from Adam, and all of a sudden you know about me, you know what to ask about me, and to do it in such a way that it doesn't feel creepy because you're not my primary care person. I've never met you. How do you know all this information about me? The presentation of that, and I got to experience and how it was delivered, was very warm, and it created a very personalized experience. And I am a person, like I use this example all the time, is I'm a frequent traveler, and I expect that the airlines and the hotel will treat me as such, and they will know me, and they will know what I want. And yes, I have high maintenance requirements on that. And I think it's okay for patients to carry that assumption into healthcare. At this point, it's pretty unacceptable that we're not sharing data, and that providers don't know they can't share it. So I think it's beyond virtual care. We're seeing it everywhere, that this need for sharing data to not only help the provider, but to create that warm patient experience is why virtual care will remain sticky and be something that people kind of gravitate towards. Because if it was cold, disruptive, and it didn't fit in, they were missing a bunch of information, it's not going to last, right? We have to create that cohesion in the experience.
Well, in the old way of having to get data from other doctors, that just doesn't work. I mean, doctors already don't have enough time. I mean, I used to watch my dad as an optometrist need information on a patient, and would have to fax a form to another doctor's office asking them to please send it. I mean, that's not a scalable healthcare solution. And, that's why we have to embrace this new interoperability stuff, because there's no way that we can scale at the way the technology has to step in. There's no other way around it. And, that when you look at just the data around the number of doctors and medical professionals in our country, and the future of our population and the ratios that are in place that we're headed into, that's a scary number. I mean, the AMA pointed out that from 2010 to 2020, the number of physicians 60 or older was at 48%, and the physicians under 50 only grew by 16%. It doesn't take a genius to realize that we're in trouble because in another 20 years, there aren't going to be nearly as many physicians out there to help all of us, who are in that, going to end up in that age group that needs a lot more care. So,
Travis, add to that the burnout rates for physicians presently that are at an all-time high, largely because of administrative burden, which is something that can be significantly relieved by having information at the point of care necessary to make good, timely clinical decisions. And then I would say, just to add to the statistics and fuel the fire there, 2 years ago when recruiting primary care doctors, if you look at the number of openings for primary care doctors versus the number of graduates from medical school going into primary care, there were only enough graduates coming out of training, going into primary care to meet 40% of the openings available or need for primary care. So it just shows you, and again, it goes into the expansion of care models, including ARNPs and their privilege expansion. There are many, many different attempts to address the provider shortage. One of the most important that seems to be the least talked about is improving their experience of care, so that those people who've already committed their lives to doing it want to continue to do it. And the information is
absolutely. Absolutely. And I do believe, going back to virtual care, that's a mechanism that we have available to us to help solve two of those problems at one time. One is access at a more convenient time for people, and the ability for professionals to not have that burnout, where they're able to provide an alternate way of providing care. I talked to nurse practitioners a lot recently about what we're doing and engaging them in our virtual care platform that we're building. And the number of them that are saying, when can we sign up to provide, that professional service in a virtual aspect is amazing. And the reasons are what you just said. They say, I have to be in this building and deal with politics all day and bureaucracy in this building. I'm hanging out with sick people all day long. I'm wearing a mask all day, and it sucks. They're not having fun, and they get tired, and they say, I'm done with this. This is not what I signed up for. But when we talk about virtual care, the reaction to many of them, and I mean a major majority of them, is I got into this profession to help people. That's all I want to do. If I could have 15, 20-minute consults all day long and just help people manage their, minor issues to help release some of the burden on the healthcare system, absolutely, sign me up. So I think that it's headed there whether we like it or not, is kind of the point.
I love it. I love getting back to managing patients as opposed to doing things to them. And because sometimes that's all it takes. One other point that you guys made, Trace, when you guys were talking about the interoperability and the scaling of digital information exchange versus fax and older methods, the other thing that's important in virtual care related to that too is timing. I mean, if you're providing virtual services after hours, you can't call a doctor. You can't fax something to a doctor and expect that you're going to get a response in time to actually impact the clinical visit that you're getting ready to entertain or are in the middle of. So digital information exchange in those circumstances is the only way to get that information effectively and efficiently and preserve the business model as well. So
Travis, I'm curious on who Reperio is targeting as your kind of your initial customers. How do you guys see rollout and the use of both the biometric kit and the virtual care services?
Yeah, so out of the gate, we have focused because at the moment, it's been primarily the biometric kit. So what we've been focused on is providing support for employers directly, because a lot of healthcare obviously is driven by the employer because they're the ones with the health plans. And so we've been trying to focus our efforts on getting our biometric screenings into this new hybrid workforce where people are not physically at a building and aren't driving around and would prefer to do these kinds of things at home. So that's been a focus up until now. But as we're now adding the virtual visit component and being able to pull in health records, historical health records into our systems and provide this full visit, now we're talking to providers, payers, other kinds of healthcare organizations to fill that gap in access, both in the cities and rural areas. Everybody talks about that this is a rural area problem, this access to healthcare, and that's baloney. It happens just as much in the cities. And I think even sometimes it depends on the city, but it can be even worse because the population way outweighs the number of providers available.
Yeah. Well, there's complexities in the city, right? And the other thing that we haven't addressed here that I think is interesting too, around access, it's not just availability of appointments, it's also access to people who may not otherwise be able to get access to care. And what I mean by that is social determinants of health are not a respecter necessarily of socioeconomic status. Socioeconomic status is certainly a social determinant of health, but there are others as well. Transportation could be part of that, transportation difficulties, physical difficulties, et cetera, that would prevent or make an in-person visit much more difficult and likely to be postponed or rejected, especially for screening things when you're feeling well otherwise, but you need that ongoing maintenance. So this provides and overcomes some of those social determinants of health and provides access to people who may not have access as easily as we think they do, not just from a convenience perspective, but from those other deterrents.
Yeah. And, I grew up in a small town, 1,500 people, Southern Oregon coast, little tiny town. And I understand what's going on in those small towns as well. To get any kind of a test like what our kit provides in an at-home situation, if they want to get access to that data, it's an hour-and-a-half drive north to the first city that can even do something like that. And so nobody in that town ever goes and takes care of themselves because it's hugely inconvenient for them. And so that unfortunately, the town is full of chronically ill people because they don't start engaging with the healthcare until it feels bad enough. They're walking around saying, I feel fine until they're not, right? And something could have been caught if they'd have known.
Tracy, you look like you were going to say something. Go ahead, Travis.
No, go ahead, Teresa.
Sorry, I didn't want to interrupt Dr. Schoch because I could tell you were ready to say something. The piece that I am super excited about, as you kind of went into who your audience is as you move into, especially into physician offices, maybe ACOs and different groups that are managing lives that may be in these harder to reach areas, or for some reason it's just easier to get to them via virtual care. With the Kno2 connection, the ability for that provider to have their kind of normal, I'll say, mainstream EHR, so it could be one of the big ones, right, that they use for day-to-day stuff in their office, and then share that information quickly with the Reperio platform where they can perform their virtual visit and have it shared back in a very seamless engagement, because that's also been, to me, one of the biggest barriers is adoption by the provider, because it doesn't fit in my workflows. It doesn't fit in my daily, my daily work, and that we have to get rid of those friction points as part of from the provider's perspective for their own internal four walls, besides getting access to information that they may have online. So it's just interesting to me that there's so much opportunity here that creates that seamless experience. Of course, I'm always going to go back to the technology, Dr. Schoch, because I got to stick with what I know. But that is why I think there's so much opportunity.
There is, and I don't know if we want to touch on AI and how it comes into all of this, but that is something that we're also embracing with the way that we're engaging both the Kno2 platform as well as our kits, and also the conversation between the medical professional and the patient. I'll go back to a little story that kind of paints a picture of this situation. When I was a kid, my dad used to be seeing a patient in an eye exam, see something going on in their eye, and he would then get up and say, I'll be right back. And he'd go into his office and he'd pull out all his medical books and he'd start flipping through them, trying to figure out what's going on with them and potential diagnosis and treatment plans, and trying to understand what something he hasn't seen before, isn't super familiar with. And then he would go back and say, okay, so I think this is what we got going on. Here's what we're going to try. And that's a very laborious appointment, which is not very efficient. And he's only getting information. And, my dad's a very, very smart guy. I have tons of respect for him, but he only knows what he has experienced and what he found in that one book. With AI, we have the ability to take this to a whole nother level. Not only can we provide support for the medical professional for the visit in real time, we also can provide them with knowledge from tens of thousands of medical professionals instantly. So they're not alone in a visit when you can bring AI into that conversation. And so the way we're doing that is we're taking medical history and current biometric data along with the conversation that's happening in real time, and we're feeding that into an AI engine that we are then using to help facilitate a more productive and efficient conversation. We're not using AI to guide the patient in any way. We're presenting it only to the medical professional to use as a tool to help them say, oh, I hadn't thought of that question. The AI is telling them, hey, you might want to ask this. Hey, here's a possible treatment plan. Here's a potential diagnosis. Here's some medication you might want to consider in this situation. It's still up to them. We're not trying to take the control out of their hands. We're just trying to help facilitate a more well-rounded and fully educated conversation in that moment so that it can be as efficient as possible.
I love that. And
what I saw there, sorry, Dr. Schoch, I think we may have a delay between us. My apologies. What I saw was amazing on how they were using AI in its early stages, because I think conservatism is the right approach with AI right now, that it was provider-led and they were responding to it. And then the feedback loop for their AI engine, things were suggested, because we all know AI is imperfect right now, that were not appropriate. The feedback loop, they're responding right back saying, no. And so it was constantly learning, as LLMs should be doing. And so it's just going to get better over time. So from a technology perspective,
Absolutely.
Again, I thought it was fantastic what was being done.
Yeah, and I think the idea of a provider-led or provider-directed AI assisted visit, every provider wants that. And I think one of the things you didn't mention, Travis, but you implied is it reduces the administrative and cognitive burden associated with doing the work, such that you're actually making quicker, better clinical decisions in a more timely manner, and love that. It's a very interesting use.
And here's a tiny addition to what the point you just made. The time that a doctor takes is not, people don't understand what actually happens after they leave the office. And they think that visit is the visit. My father spent every night of as long as I can remember coming home with a pile of charts that he now had to document the details of every visit. Because you have to have a record of the conversation, what you decided, what the patient said, what the treatment plan was, when you're going to follow up. All of that has to be put somewhere so that there's a record of it. And so we're able now to take, at the end of that virtual visit, take everything that happened in that conversation and immediately create what's referred to as SOAP document that breaks down everything that happened in that visit, as well as just discharge notes that get provided to the patient afterwards. And all of that happens in real time. The doctor or nurse practitioner are able to edit any of the things that the AI put in there, and then they can hit a save button and it's done. And so that in itself is going to free up so much time in their daily routine.
Oh yeah, I love that, and it's really interesting that you mentioned that, because a visit for a physician is a visit where decisions are made, but there's always action items that are assigned after the visit that the physician or provider goes and does. Right, to your point, the visit isn't that 15 minutes. It's a really good point. The other thing is interesting to me too is we have many different methods of trying to assimilate information and document our decisions. And there are none as easy as having an eye in the sky, listen to you speak, put the work down, right? And that's part of what this is doing. And it allows you to get a head start with 80% of the material there. And I, as a provider, go back in and change the things that I think might need to be more specific or different or whatever. I love that. And I can imagine providers using your service chomping at the bit around that.
Yeah. Now, and the next phase of this that we're going to be leaning into in the next few months, that whether or not I should share the details of it, I'm going to anyways, because I think everybody, we're not the only company trying to solve these problems, and I think if we all work together, I think that's a good thing. So translation is obviously a huge barrier in the patient-doctor relationship. With AI, one of the things that we're going to be able to do with our virtual care model is being able to, as the doctor or nurse practitioner is speaking in their native tongue, the person on the other end will hear that in their native tongue. And when they speak, the doctor will then hear it in their native tongue again. So what is going to happen is we're now going to be able to have real-time conversations with our doctor and understand everything, no matter what language we speak. We don't have to go find somebody that speaks the language and get them on an iPad or bring them into a hospital to manage a quick conversation about a diagnosis or a plan to understand what's going on with somebody. So I think we're in for some pretty fascinating shifts.
Yeah, that is absolutely amazing to me, because I think, again, I don't want to gloss over the idea that not only is that neat technology and neat in terms of being able to communicate effectively with the individual, but at a population level, you're overcoming significant determinants of health. A person that doesn't speak the same language as their provider and doesn't have a mechanism to do so is far more likely to have bad outcomes, far less likely to achieve optimal outcomes because they don't understand it. And that's absolutely fantastic to hear that.
Travis, I think there's so much. I'll give you moving into the home too. Obviously, that's where you're delivering. But as we look at all the care that's being moved to the home, the ability to their home care and home health and private duty, all of them are experiencing staffing shortages for nursing, for nurses' aides, everything. The ability to provide, at least augment some of those services based on what you just said, especially for things like language barriers. And so it's amazing to me. I think the opportunity is so large for your organization. I think it's amazing.
I want to tell one other quick story to show just the denial of what's happening by our healthcare system. And it really accentuates kind of this whole conversation. My brother-in-law went to get an annual physical, and Therasa, you've heard me tell this story before, but he lives in a rural community where access is not great, and so he made an appointment in a city that's a couple hours away. Showed up at the doctor's appointment, weeks later, and walked into the waiting room, filled out his paperwork, and then went and sat in another room where a nurse came in and did the typical measurements and blood pressure and all the normal things. And then he sat there and waited. A few minutes later, they rolled the TV into the room, and up popped the doctor so that he could have a virtual conversation in a brick and mortar building with no data because they couldn't do any blood tests there.
Right.
And then he left, went home, 2 weeks later got a bill because that person on the screen wasn't credentialed under his insurance and he had to pay out of pocket for it. But that is my point with that story, is that is how hard the brick and mortar parts of the medical profession are fighting this. They know that virtual care is the only way because they're using it in their buildings. But for some reason, they think that same visit in someone's home doesn't qualify. So there's a lot of mixed signals going on around why we're not just helping companies that are trying to bring virtual care to the forefront. The regulators have got to get out of the way and let this happen because it's going to happen one way or another. They're just slowing it down.
Yeah, and I think, quite frankly, the market forces are demanding it be part of the solution. I don't think we're going to be able to escape in the future the luxury of virtual care. We need to embrace it because I think it is a solution. Guys, it's been a really robust discussion. I want to wrap it up there and take a quick break and come back for some final thoughts with the group. Yeah, Travis, go ahead.
I was going to say I have one stat that just came out yesterday that hammers home what was just talked about.
Yeah, sure. Please. Yeah.
A survey was done, and there are over 1,000 people in the survey from 4 generations. 64% of them said they would trust a diagnosis made by AI over that of a human doctor. That's a crazy stat that people need to be paying attention to.
Yeah, you may have changed my final thought coming into the break. I have to think about that. Let's take a quick break and we'll come right back.
Hey everyone, my name is Matt Becker, VP of Interoperability at Kno2fy. I wanted to take a moment to introduce our connectivity report. Did you ever wonder who in your area you could connect with digitally and reduce the manual activities associated with clinical information exchange? Well, simply visit Kno2fy.com, click the link for connectivity report, then enter your name, email, and zip code, and we'll send you a report to show those providers and provider organizations already connected and waiting for you to join them. Take the first step to getting Kno2fy connected. It's free, takes less than 30 seconds, and will spark digital transformation that could revolutionize your business. There's even a how-to video to make sure you get the most from the report.
Connect, listen, transform. This is Kno2fy with your hosts, Dr. Peter Schoch and Therasa Bell.
Welcome back, everybody. As we wrap up today's robust discussion, I would be remiss if I didn't again thank Travis for being here. We've really enjoyed the conversation, learning about Reperio, the different things that you guys are doing, and more broadly than that, getting a perspective on virtual care and its role in healthcare. So really appreciate the conversation. As we always do, I want to make sure we wrap up and have any opportunity to give any final thoughts, make any clarifications or emphasis of points we've made before, or if we've missed something that we really wanted to share with the group to come out and do that. And Therasa, I'll start with you, and then Travis, go with you, and I'll close us out.
Yeah, I think this is Travis, you may not have heard this from me, but the team rolls their eyes every time I say it. And I've said it in a lot of podcasts, but I fundamentally believe if I say it enough times, it's going to come true across everywhere, is when interoperability moves from a noun to a verb, we've done our job, right? And this is an example of, it's not just connectivity for connectivity's sake, it's driving outcome where it's moving to an action, it's moving to an outcome, and that's the verb for me. So it's really exciting to see that being true here, is where you've connected and are connecting, continuing to connect to the ecosystem to get to an outcome and get to real value, not just for the purposes of sharing data, but to share the data in a meaningful way, both for the provider and the patient, and ultimately the payers as they're involved.
Yeah. No, that's a great way of putting that. I look at healthcare, and I am one of the 100 million people. So it's very easy for me to see why I don't go. And so, a lot of our decision making here in direction and why we're building what we're building and pushing so hard against these brick walls that are in front of us, trying to break them down, is I know as one of those people how it has to work for me to engage. And I'm not the only one. I hear about it all the time. We see comments on all kinds of news articles about healthcare. The people commenting, they're all complaining about the same thing. It's just that the people in charge aren't listening. And our goal and your goal is, I think, just keep hammering it home and keep pushing and pushing and pushing until we force it. Because at the end of the day, just like everything else that has shifted over the years, people want what they want, and they're going to get it. Uber brings things to our house. Amazon delivers to our home. Banking comes to our home. Food from a restaurant comes to our home. We order our groceries and they come to our home. It's time for healthcare to make the switch. It's going to happen anyway. So it'd be better if we all worked on this together and tried to make it a seamless experience.
Yeah, I couldn't agree more with those comments. And I'll just end it with my final thoughts. And that is what I appreciate in Reperio and the conversations we've had and the work you guys are doing is that you guys are building a chassis that makes virtual care an essential part of our healthcare delivery system and not an appendage that sits off on the side. It's connected. It is convenient. And while you guys are focused on particular use cases, any new company is focused on a particular use case, you're creating a chassis that will allow additional use cases and additional expansion in the future for the relevance of virtual care. So I couldn't be more excited that we're partnered with you and being able to help be a part of that chassis and infrastructure that you guys are building from a virtual care delivery perspective. So really enjoyed the conversation. And I just want to thank you again, Travis, for the opportunity that you've given us to be with us and to partner with y'all.
Absolutely. And thank you guys for working with us. It's going to be a fun road ahead.
I think it is too. That's it for another episode, guys. We'll see you next time on Kno2fy.
Thanks for joining us today. That's a wrap for this episode. Please subscribe or follow on your favorite podcast platform to make sure you don't miss an episode. Get Kno2 connected today and set yourself and your organization free to unlock your potential. For more information on the value of being Kno2 connected, visit us at www.kno2.com. Follow us on LinkedIn or Twitter. Connect, listen, transform.